Kia ora. Welcome to day 5 of the COVID-19 Masterclass. I'm Jackie Haddingham, manager of the Otago Global Health Institute, OGHI for short. Today's webinar will run for approximately an hour and a half. We should finish at around 1:30 New Zealand time. Our webinars are all being recorded and will be available on the OGHI website later. We're also live streaming through the OGHI Facebook page. During the webinars, each speaker will give their talk, and you can ask questions at any time through the Q&A function at the bottom of your screen. After the talk, I will then read the questions aloud for the speaker to respond. If we're not able to get through all the questions, we'll ask the speakers to provide written responses, which we'll post on the OGHI website. There may be a slight change in our program this morning. One or two of our speakers have not yet come online, so we may actually switch the program around. On your program, it says that Dr. Ashley Bloomfield will be speaking first today, but there may be a slight change to that program. So what we're going to do is the second speaker of the day, Dr. Marissa Kaloga, who is a lecturer in the University of Otago's Social and Community Work Program, and who coordinates the Communities and Organisation series. Her research is in the area of economic justice. Marissa will speak first today, and her presentation will cover economic justice, social determinants of health, and New Zealand's post-COVID recovery. Marissa.
Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you to the Otago Global Health Institute for hosting the series and for your invitation to speak today. And thank you to the attendees that are here live and those also watching the recorded seminar. And thanks for your flexibility in changing the schedule around a little bit. Today I'm going to be talking about economic justice, health, and New Zealand's post-COVID opportunities. So I'm going to begin with some key concepts in systems thinking that are going to allow us to use the same lens of inquiry. These are high-level overviews, and references are available at the end of the presentation if you'd like to take more of a deep dive. After this, I'm going to review what income and wealth inequality are and how they've operated in New Zealand. Following, I'm going to compare the effects of the 2008 global financial recession to what we're seeing now amid the global COVID pandemic, and finish up the presentation by offering 3 big ideas for creating a better future. So before I start talking about money and economics, it's important to center this talk on what actually matters, which is people. My interest in economic justice is born from an understanding of the importance of material, not just theoretical justice, but in the end, it's always about people. So I'm going to take a few minutes to introduce several concepts: systems thinking, social determinants of health, intersectionality, privilege, and discrimination. These are key ideas that are necessary for understanding the kind of inequality that exists and how COVID-19 both reveals and enhances it. So to do this, I'm going to show you a series of circles. And at the end, we should all be thinking in systems. So the first circle I'm showing you is the ecological systems theory. This is social work's person and environment approach, which is centered on Bronfenbrenner's theory, which is shown here. It conceptualizes the individual as nested within a complex set of systems, each level interacting with the next and ultimately having influence back on the individual. They go from individual to a microsystem, which might be a family or school, a mesosystem, which is the interaction of those microsystems, the exosystems, which you can think of as industry or community or social services, and then the macrosystem, attitudes and ideologies in a culture. Because of this, one cannot understand the individual independent of these systems. They are one and the same. This can be understood to operate on biological, psychological, social, and environmental levels. The second circle is the social determinants of health. which will likely be familiar to members of Otago Global Health Institute. They're shown here using Dahlgren and Whitehead's 2006 rainbow model, and it's a similar approach to understanding the factors that influence a person's health status and outcomes. You can see local economy, community, natural environment, global ecosystems. These are complex structures and systems that influence a person's health, such that their health cannot be understood independently of these systems. Ecological systems and social determinants of health are helpful in creating a systems thinking framework, but they're not sufficient in understanding how individuals experience that system. Intersectionality, shown here, is a term created by Kimberly Williams Crenshaw that means the interconnected nature of social categorizations, which create overlapping and interdependent systems of discrimination and disadvantage. This was originally meant to support the creation of a feminism that included the experiences of women that were both female and Black in America, but it's proven to be an important concept to understand the differential impacts of large structural discrimination on individuals. So intersectionality helps to explain how privilege and oppression binaries shown here translate into lived experiences. Certain social identities are privileged, the ones above the line, while others are oppressed, the ones below the line. In the US, a prime example would be that white populations are privileged, while being a person of color exposes the individual to oppression. There's many listed in this diagram. They could be male, female, upper class, lower class, young, old, European origin, or indigenous. The binaries operate across all levels of the ecological system, from internalized oppression all the way to national level structures that intentionally or unintentionally systematically oppress minority populations. On an individual level, if one person discriminates against another, it could mean not getting a job or something like that. But when it happens on a systemic level, remember we're systems thinking right now, there are population-wide impacts that I'll explain in a moment. But if we understand discrimination to be intersectional and structural, this means that someone who is female, poor, and an ethnic minority will be further marginalized by the combination of those intersectional identities. So when we see inequalities in data, which we will, they must be understood intersectionally. Oppression and discrimination are created. They're not the normal order of things. When we see them in our communities and in our countries, we must accept that they were created and must be actively dismantled. So I've shared my circles with you, and we have a better shared lens now using an intersectional systems perspective. So how does this apply to wealth and income inequality? This graph is a compelling one, and one that has generated much academic debate in the past few years. On the y-axis are the index of health and social problems. On the x-axis is the degree of income inequality. We can see that there is a strong trend for countries with higher income inequality to also have a higher degree of health and social problems. This is population-wide. It's not just restricted to those in poverty. So income inequality itself shows that it's linked with health problems and population-wide increases in infant mortality, diabetes, heart disease, violence, and others. So income inequality, the first of our key concepts for today, refers to the difference between earned wages across all deciles. So income itself is just restricted to paid wages and doesn't include assets like houses or liabilities like consumer debt. So the graph to the left of the screen shows the trends in income inequality over 30 years in New Zealand. The bottom 10%, the bottom line is the poorest 10%, then above it is the middle, and the solid gray line is the richest 10%. But that solid black line is the richest 1%. These trends continue today. However, the trend lines represent an overall figure for all of New Zealand. So what do you think the gender and ethnic makeup of the top line is? What about the bottom? Do you think it's an accident that it ended up this way? Looking within just one sector, the ways that intersectionality play out in income inequality is jarring. We can see at the top, European men, and at the very bottom, Pacific women. And this is in one specific sector. It's important to observe because general figures of income inequality do not take these large differences into consideration. The difference in income is not just a class issue. It is a result of systemic injustices that place certain groups of people at lower wages, the result of overt discrimination, as well as structural systems that disadvantage non-PACA. It is important to note that in the public sector, there's significant progress in this area. One of the reasons I chose to highlight it, because things can be done to address inequality. And when those things are done, we do see change. So I teach the community organizations paper in the social and community work program. And so in class, we talk often about macro issues and analyze structural inequities that create or contribute to social injustices felt in the individual level. And during these discussions, and I've taught these courses in the US and in Africa and in New Zealand, the question is always asked, okay, so how do you solve poverty? It's a good question, but it's one that obviously a struggle to answer. I don't think that poverty can be eradicated completely. It can be mitigated and managed, but not necessarily erased. Instead, let's rephrase the question and think, how easy is it for people to get out of poverty, to get out of that economic state? This is economic mobility, and how long people stay in poverty is crucial. So while individual decisions and actions have important roles to play, at its heart, it's a systemic issue. Because of this, addressing income inequality is insufficient. The more important question when considering this is the idea of wealth inequality. So income inequality figures show some inequality must be addressed through interventions like living wage, employment, and education programs. However, it's just not sufficient. Wealth inequality illustrates the true extent of the drastic disequilibrium of resources in New Zealand. Wealth is things like property and housing, cash and financial investments, retirement savings, valuable and durable goods like cars or furniture. The image to the left here is a rather well-known wealth tower of New Zealand. If you look at the top few floors, you see that the wealthiest 1% have them all to themselves. Then the next 3.5 floors are the wealthiest 10%. And then the next 40% have 4 floors. But the most radical thing here is that the poorest 50% have just half of the ground floor. This is the true extent of inequality of wealth. If we again apply the intersectional lens, we can see that that bottom floor is not made up of an equal representation of all the ethnic groups in New Zealand. Here we see the median net worth by ethnic group in New Zealand, and European people have a median net worth of 114,000, Asian people 32,000, Maori is 23,000, and Pacific is 12. So that ground floor of the tower is disproportionately non-PACA. While communally held Maori assets are not included in these figures, their inclusion would not fill that gap shown here. So by now you might be thinking, this is very unfair. Well, I agree. Social and economic justice are really central concepts for social work researchers like me who engage in action and community engaged research to address inequities. So what is social justice? It's a term that comes up quite a bit, but it can be tricky to pin down. I really like this Salvation Army's explanation of social justice because I think it's a really accessible idea that social justice is about fairness. And one of those aspects of fairness is about distribution of income, wealth, and power in society. This has always been central. Economic justice and how resources are distributed. And I could give you a grand, $64,000 word explanation of economic justice, but the hamburger says it better than I could. Martin Luther King Jr., this is a quote here, that he's always understood social justice to be tied to economic justice. And he says, now our struggle is for genuine equality, which means economic equality. We know it's not enough to integrate lunch counters. What does it profit a person to be able to eat at a lunch counter if he doesn't earn enough money to buy a hamburger and a cup of coffee? It isn't enough to be able to go to the restaurant. You have to be able to buy the hamburger. As such, economic justice is operationalized social justice. It's the tangible result of policy or theoretical approaches. So while the bottom floor is quite obviously deprived of social justice, the real question is, can they afford the hamburger? Lived material realities are important. no one could work hard enough or enough hours to address the 9-to-1 ratio between the top 10% and the bottom 10%. It's a question of economic justice. So this brings me to thinking about our situation now. In 2008, irresponsible and risky investment strategies by the American upper class went very bad. And this led to the 2008 global financial crisis. It shook the world into recession and was felt in New Zealand. While the 2020 COVID crisis is primarily a health emergency, it has significant spillover effects in multiple areas. It's already impacted the economy through decreasing international travel and restricting tourism. And it's important to understand that the way that the global financial crisis affected populations will likely be seen again. This graph shows the increase in unemployment in New Zealand as a result of the crisis in the late 2000s. And understand that the unemployment figures here disproportionately represent people from minority populations. As a result of the ongoing COVID global crisis, current unemployment is 4.2%, expected to rise to 8 to 10% in the spring. These numbers will also contain more people vulnerable in our communities. So crises do two things. Whether they're financial recessions, pandemics, or natural disasters. They reveal the inequities already existing in social structures, and they further entrench those inequities. On the right are 3 examples of how this might play out. Minority populations overall have less money and less savings. This means they can't absorb unexpected expenses and opens up to financial and asset losses during a crisis, like a home. Minority populations have lower levels of education, which leads to less employment stability. So that precarious employment, which might be part-time, temporary, or contract work, is often the first to go during a crisis. And finally, minority-owned small businesses are overall less capitalized. Because of this, they're less likely to have reserves to support the continuation of their business during a crisis. This leads to negative financial outcomes for marginalized populations. Less money equals loss of material wealth. Precarious employment equals higher rates of unemployment. And less capitalization leads to business bankruptcy. So solutions must include approaches that both repair what was lost and also provide additional opportunities to reduce the underlying inequities. So now that we've peeled back the layers of the onion, what are we supposed to do with that wicked problem of economic injustice and income and wealth inequality? There's so many ways we could address this, but today I'm going to talk about 3 ideas that could make a difference. So these solutions aren't mine, and they're not hard to find. Universities, government ministries, and research institutes have been writing about them for some time. The difficulties lie in actual implementation of these solutions in complex social, economic, and political contexts. The first is reform tax policy. So wealth is accumulated in those top few floors as a direct result of tax and inheritance policy. It wasn't always that way, and it doesn't have to continue. The ability for a few to own the most is not equitable. And the 2 most popular ways people have proposed to do this is to start having a wealth tax that would tax capital gains, as well as having a higher income tax band. Housing stability. Middle-class wealth is created through homeownership in many cases. And right now we're seeing an entire generation that might be priced out of this opportunity. So it's really important to build quality, affordable housing, but barring that, it's important to make long-term renting a more stable and appealing option for people who aren't going to buy houses. And finally, inclusive entrepreneurship. Business creation and ownership must be accessible across all populations. Entrepreneurship is a channel for increased revenue, but even more importantly, community leadership and political engagement. We need to create business support structures that address hidden needs of vulnerable populations, as well as potentially do capitalization of minority-owned small to medium enterprises. So my own research on economic justice in New Zealand examines entrepreneurship in minority populations. As a community development social worker, my practice experience was in this area, and I've worked in the US and in West Africa to support minority-owned small to medium enterprises and to research what they need to be successful. On a structural level, I'm working on a project to map Dunedin's entrepreneurial ecosystem using social network analysis. I want to understand what services exist and who is using them so that we can understand how might we create a more inclusive and effective system. I'm working to create inclusive entrepreneurial support organizations. Ethnic minorities and women are underrepresented in entrepreneurship in Dunedin. So we are engaging with community partners to understand the situation and working on community-led intervention creation using a human-centered design process. Finally, I'm working with my colleague, Dr. Anaru Ekitone, to create an economic justice research and action network to bring people together who are all working on the solution to use a justice lens to examine economic inequality issues. And we're currently gathering invested parties who would be interested in working on this area. So I'm going to end my presentation today with the claim that economic justice is a determinant of health. Without it, the vision of a healthy New Zealand would be difficult to attain. The impacts of income and wealth inequality were apparent before COVID. The effects were not random, but they were the result of decision-making over time. They negatively affect minority populations in intersectional ways and must be actively dismantled. COVID revealed their effects and also enhanced them, such that the general population at large cannot look away right now. And that's actually a good thing, right? Because we all want New Zealand to be prosperous and more equitable. The solutions to the problems, thankfully, are not unknown, but we know that implementation is complex and difficult. And so I propose that post-COVID, there is a unique opportunity to come together using the focus and political unity of the country to address these long-standing inequities using a social and economic justice lens. Thank you.
Thank you, Marissa. I'm sure we'll get questions coming through soon. Nothing has come through yet, but perhaps people were taken unawares because we had to have your presentation first. While we're waiting for one or two questions to come through, are there any perhaps additional insights you may want to share from the work that you've done, either related to your presentation or otherwise?
Yes, it has been interesting moving from, I was working in West Africa as a Fulbright scholar doing similar work. And prior to that, in the US, doing similar work, working with minority populations and small business development. And in New Zealand, and there obviously are very contextual differences between all of these three places. For example, Guinea does not have a functioning social welfare system. The US has somewhat of one, and New Zealand has a very robust one. And the way that this impacts minority populations who are interested in starting small businesses has been interesting to look at.
Thank you. Thanks very much. Let's have a look. I think we may have one or two here. Okay. Thoughts on universal basic income?
You know, it's interesting that when it has been implemented, it has shown to be successful. I think there's a Canadian implementation that showed that it did have positive effects on health and economic justice. And we had a Democratic presidential hopeful that did a great job of explaining what it actually was to the American people. So I think that it's an opportunity. I don't have any expertise in that area, but I do know that the studies that have actually done it have seen promising results.
Thank you. Just a comment here, amazing presentation, thank you, from one person, so that's always nice to hear. Do you have any comment to make on possible associations between wealth inequality and outcomes from COVID-19? If they exist, how might they operate?
And, you know, I spoke to this briefly in the presentation, and that any type of crisis disproportionately affects minority populations. And we see this in COVID as well. Then people who are infected, the impact of those infections, the access to healthcare, all of that puts pressure on households that don't have extra. And so those households are more vulnerable and tend to have stronger reactions to it. And likely because the employment to begin with was precarious. And so precarious employment, which may be something like a temporary worker or a seasonal worker, those wages also tend to be lower. And so they do overall impact income inequality.
Okay, quite a complex topic then. And Marissa, we're actually going to go go to our next speaker now, because he does have a very tight schedule. Thank you so much for your
Thank you for having
presentation.
me.
Thank you very much.